it's a nursing issue that we need more people in nursing. The lower percentage of males identified that there's obviously more men out there that could come in. I think now there's more and more issues, more and more pressures involved. It's something that can be explored and really take the opportunity as it's presented itself.
The Men into Nursing Together started in June of last year, so 2018. It was noticed that there was quite a gap in the amount of male students that was at university, and it's something that not really become noticed to me while I was out on placement, that there was a lack of male nurses on the wards.
I think obviously there is a sort of stigma in a way whereby men don't do nursing. You hear about nursing and you just think women are doing it, you know, Florence Nightingale, no one's there.
There's been no input. You know, they don't come round to schools and say, come and be a nurse, you don't have to be a woman.
It's not triggering the question in male students to say, I could do that, could I do that? What's that involved? It just really enforces the stereotypes in a lot of ways.
I've had people that haven't wanted me to care for their relative because I'm a man, and then you sort of have to say to them that I'm a member of staff on duty, I've done the same training as everybody else, and I'm here to do the job that anyone else can do here. And then there's also the, oh, I don't want him, he's gay. For a straight man to think, oh, I'd like to become a nurse, they've got this misconceived perception that all male nurses that are in the profession are gay. This isn't the case.
I did actually surprise one chap. He was visiting somebody, and to be honest, he did think male nurses were effeminate or even gay. Obviously, I wasn't, and he was very surprised that somebody like me came into nursing.
You can turn any negative into a positive if you say, right, well, what are you doing that course for? You know, you're a bloke. Well, I'm going on a night out with 20 girls, mate. What are you doing?
A lot of female staff that I've worked with have said, oh, you'll go far. And to start with, I thought it was a compliment. When I've challenged them about it, why are you saying that I'll go far? They've said, well, you will, you're a man. Before you know it, you'll be in management. So I'm having to remind staff that I don't want to go far because I'm a man, I want to go far because I'm good at what I do.
I think the group gives a contact point, someone to question, someone to go to with these questions.
Sometimes you can feel lonely in a way, like there are not enough men, or with the men's group, so it's like men in nursing that come together, so it's quite helpful and it makes you feel relaxed.
We're not trying to say that we want nursing to be all male, because that wouldn't work, and it's not what we're about. All we're trying to do is promote the profession to males in society.
And if this group helps to ease the way for more lads to come into it, then yeah, I'll be out there shouting for them. You know, I'll be an advocate, no problem.
We're trying to get out into schools to show that there are men within the profession. We tell them about what we do on a daily shift and then answer any questions that they've got. We're also trying to get more out into articles, journals, to say what we're trying to do and just get as much sort of coverage as we can.
Yes, you do get a job at the end where you get paid, but I feel like that sense of you're making a difference in someone else's life is very important, and every day as nurses you're doing that, you're making a difference, and you're changing someone's life with the way you communicate with them and just help them out.
You see them how they come in so poorly. They've had a heart attack, they think it's the end of the world, and it's my job to say no, it's not. I can tell you it's not the end of the world. It's a back step in your life's career. It says, we'll get you right.
Just try your best to make a difference, and the times it's acknowledged, it really makes it rewarding. And you do physically save people's lives on occasion, which helps.
I don't want people to think that they can't do it just because of their gender. I want them to think they can do it because they've got the desired values, they can do the job, they can provide care, and they want to devote themselves to making a difference to other people's lives.